Have you ever wondered what actually happens during a pap smear? A lot of women get nervous just hearing about it, imagining something complicated or painful. But don't worry, this isn't surgery, and you won't need any anesthesia at all. In reality, it's super quick, usually only taking a few minutes. You just lie back on the exam table and place your feet in the stirrups, just like a routine gynecological exam. It might feel a little awkward at first, but it's completely normal and safe. The doctor or nurse will then gently insert a small speculum to hold the vagina open. This allows them to clearly see the cervix. Don't let the word speculum scare you. It just feels like a gentle little stretch, nothing more. Next, they use a tiny brush or spatula to carefully sweep a few cells from the cervix's surface. You might feel a little pressure or a light scraping sensation, but it really shouldn't hurt. The entire process is usually over in about 2 to 3 minutes. The collected sample is sent to a lab to check for abnormal cells, which, if left untreated, could eventually develop into cervical cancer. Did you know a tiny stone, just a few millimeters wide, can cause pain so intense it makes you question your life choices? So how do doctors actually get it out? When a kidney stone is too big, blocks the urinary tract, or causes an infection, doctors often use a minimally invasive procedure called ureteroscopy. No cutting required. After the patient is under general anesthesia, a thin, flexible flashlight, the ureteroscope, is gently inserted through the urethra, passes through the bladder, and travels up to where the stone is hiding. On the screen, the doctor can clearly see that little troublemaker. They might grab it with tiny forceps or zap it into dust-sized fragments using a laser. That's called laser lithotripsy. Some fragments are removed, others simply pass out naturally with urine. If the stone is larger and stuck in the kidney, the doctor makes a tiny incision in the lower back, smaller than a pencil eraser, and inserts special instruments directly into the kidney to break the stone apart and suction it out. That procedure is known as percutaneous nephrolithotomy. After surgery, a small stent may be left in place to help urine flow smoothly.